If you've been putting off your smear test because you feel nervous, embarrassed, worried it'll hurt, or you've had a bad experience before, you're not alone. Cervical screening can bring up a lot: past pain, past trauma, body confidence, fear of results, or simply not wanting anyone down there. And I want to start with something important. You deserve care that feels safe, respectful, and in your control. This video is an educational guide. It's not here to pressure you or shame you. It's here to explain what a smear test actually is, what happens step by step, what the results mean, and how to make the appointment easier. Because for many women, the fear comes from not knowing what to expect. And here's the empowering truth. Cervical screening is one of the strongest tools we have to prevent cervical cancer by finding early changes before they ever become cancer. The smear test is part of cervical screening. You might hear Pap Smear and cervical screening used interchangeably. The goal is the same: checking the health of your cervix, the small opening at the top of the vagina. A key point is that a smear test isn't a test for cancer. It's a screening test that looks for high-risk HPV, which is human papillomavirus, and if HPV is found, it checks for cell changes on the cervix. Those cell changes can often be treated long before cancer develops. That's why screening saves lives. Not through panic, but through prevention. Let's talk about HPV. HPV is very common. Most people who've ever been sexually active will come across it at some point, often without knowing, because it usually causes no symptoms and often clears on its own. Having HPV doesn't mean you've done anything wrong. It doesn't mean anyone's been unfaithful. It simply means you're human. Cervical screening looks for high-risk HPV types because persistent high-risk HPV can sometimes lead to cervical cell changes over time. In the UK, you'll usually be invited for cervical screening based on age and NHS guidelines. If you're not sure when you're due, you can check with your GP practice. You can book now and start from where you are. It's also important to know you may still need screening even if you're not currently having sex. You have one partner, you've had the HPV vaccine, you feel well, or you've been through menopause. If you've had a total hysterectomy that removed the cervix, screening may not be needed, but it depends on your history, so always confirm with your clinician. Let's take the mystery out of it. A cervical screening appointment usually takes about 5 to 10 minutes, and the sampling part is often under a minute. Here's what typically happens. You'll be offered privacy to undress from the waist down. You can keep a skirt on and just remove underwear if that feels easier. You'll lie on the couch, usually on your back, and you'll be asked to bring your knees up and let them fall gently apart. The clinician will insert a speculum. It's a smooth instrument that gently holds the vaginal walls open so the cervix can be seen. And you can ask for a smaller speculum if you're worried about discomfort. A small soft brush is used to collect cells from the cervix. This is quick, then the sample goes to the lab. So what does it feel like? For some women, it's mildly uncomfortable. For others, it's painful. And if that's you, you're not weak. Pain is information, and you deserve adjustments and support. You can ask the clinician to talk you through every step. Stop at any time, go slowly, use extra lubricant, use a smaller speculum, or change position. For some women, lying on your side helps. In some clinics, you may be able to insert the speculum yourself, and you can ask to book a longer appointment. You're allowed to say, "I'm anxious, please go slowly." The most crucial factor in a comfortable pelvic exam is muscle relaxation. This is why some women find it helps to put a hand on the lower belly and think soft belly, heavy hips. A soft belly signals relaxation. By performing abdominal breathing, it prevents the tensing up reflex. Abdominal breathing entails inhaling slowly through the nose, so the tummy moves out like a balloon. This helps relax the pelvic floor muscles, making the insertion of a speculum or probe easier and less painful. I'm keen on addressing this because I see many women complain online about how hard their testing has been and how awful the speculum is. But before you change specialists who may be inconsiderate, it's advisable to check all is correct on your side. If you've had trauma, you can share as much or as little as you want. Even just saying, "I need you to explain everything and check consent at each step," is enough. And if penetration is difficult because of vaginismus, endometriosis, menopause-related dryness, pelvic pain conditions, or past trauma, please don't suffer in silence. Ask about a longer appointment, topical vaginal estrogen if appropriate, especially after menopause, or referral to a specialist clinic if needed. There's almost always a way to make this more manageable. In the UK, many programs use HPV primary screening. That usually means one of three things. 1. No HPV found. This is reassuring. Your risk of cervical cell changes is low, and you'll be invited again at your routine interval. 2. HPV found, but no cell changes. This can sound scary, but it often just means the virus is present and the cervix looks healthy right now. You'll usually be invited for a repeat test sooner to check if HPV clears. 3. HPV found with cell changes. This means there are changes on the cervix that need a closer look. You'll usually be referred for colposcopy, which is a specialist examination of the cervix, sometimes with a biopsy. Here's the most important reassurance. A result that needs follow-up doesn't mean you have cancer. It means the system is doing its job, spotting changes early while they're treatable. Colposcopy is a closer look at the cervix using a microscope-like device. A clinician may apply a liquid to highlight abnormal areas. If needed, they may take a small biopsy or treat the area. A lot of women fear colposcopy because they imagine the worst, but most referrals are for precancerous changes, not cancer. The goal is prevention. If you're referred, bring your questions. What did my results show exactly? Do I need a biopsy today? Can I have pain relief options? What's the plan after today? You deserve clarity, not confusion. A few myths come up again and again when it comes to screening, and clearing them up can take a lot of fear out of the process. The first common myth is, I don't have symptoms, so I don't need screening. But the reality is, screening is specifically designed for when you feel completely fine. It's preventative. It's about picking up early changes before they ever cause symptoms, because by the time you feel something, you've already lost the advantage of early detection. The second myth is, I'm in a long-term relationship, so I'm not at risk. And I understand why that sounds logical, but research shows HPV can be dormant for years. So someone can be in a committed relationship, have no symptoms, and still have HPV show up later. Relationship status doesn't switch risk off. It just means this is about health maintenance, not assumptions. The third myth is, it's always painful. It shouldn't be. You might feel pressure or discomfort, but pain is not something you're supposed to silently tolerate. And if it is painful, we don't just push through, we adjust the approach. That could mean going slower, using more lubrication, using a smaller speculum, changing position, taking breaks, or stopping and trying again another day. You deserve care that feels safe and respectful, not something you just endure. And another myth, if HPV is found, it means someone cheated. But that's not how HPV works. A positive HPV result doesn't tell you when you got it or who it came from, because HPV can stay inactive for a long time before it's detected. So it is not proof of infidelity, and it shouldn't be used as evidence in a relationship. It's also worth saying this. While sexual contact is the most common way HPV is passed on, people can get very hung up on blame and where it came from. The most important point is that an HPV result is medical information. It's about next steps and follow-up, not judgment. So if you take one thing away from this section, let it be this. Screening is routine healthcare, and HPV results are not a relationship verdict. If you're anxious, you can say, I'm due my smear test and I'm nervous. Can I book a longer appointment? I've found speculum exams painful before. Can we use a smaller speculum? Please talk me through each step and check consent. I may need to stop and restart. Is that okay? A good clinician will respect this straight away. If you've been avoiding your smear test, I'm not here to shame you. I'm here to remind you your comfort matters, your consent matters, and your health matters. Cervical screening isn't about being brave. It's about giving your future self a layer of protection, quietly, routinely, and with support. And if you want to understand why screening matters, how HPV links to cervical cancer, the symptoms to take seriously, and what happens if anything abnormal is found, tap the cervical cancer video on your screen now. It's a clear, practical guide so you feel informed, not frightened.